You could have syphilis right now and not even know it. Yes, this silent disease might be inside your body, slowly advancing without showing any signs. Think that's an exaggeration? Here's a scary fact. Thousands of people live for years with this infection without realizing it, and by the time they find out, it might be too late. Treponema pallidum is a master of disguise, and that's exactly what makes this STD so dangerous. What if I told you that a simple test could save your life? And that, despite being curable, syphilis continues to spread at an alarming rate because people don't take prevention seriously? The truth is, ignorance and negligence are the disease's greatest allies. But don't panic. Today, you're going to learn everything you need to know to protect yourself and avoid falling into this invisible trap. Syphilis is like a sneaky enemy that infiltrates without making a sound. Caused by the bacterium Treponema pallidum, this STD has a higher transmission rate than HIV and hepatitis B, making it even more dangerous. The problem? Most of the time, its early signs go unnoticed. An infected person can go about their daily life without suspecting a thing while the bacteria continue to spread. And the worst part, without early diagnosis, this infection can evolve into serious complications, affecting vital organs and even leading to death. What makes the situation even worse is the alarming rise in cases. In 2019 alone, more than 150,000 new diagnoses were reported in Brazil, meaning that over 400 people were infected daily. This explosion of new cases isn't limited to specific groups. Men, women, young adults, the elderly. No one is immune to the risk. The declining use of condoms and the false sense of security from advancements in treating other STDs have fueled this surge. Syphilis is back with full force, and ignoring it can come at a high cost. Many believe that this infection is restricted to those with a promiscuous lifestyle, but nothing could be further from the truth. A single unprotected sexual encounter is enough for Treponema pallidum to find a new host. And that's not all. The disease can also be transmitted from mother to child during pregnancy, leading to devastating consequences for the baby. The lack of apparent symptoms in the early months makes many people believe they're healthy when, in reality, they might be carrying and spreading the bacteria without even knowing it. Syphilis doesn't forgive carelessness and spreads like an invisible ghost. But has this disease always been this dangerous? The truth is, syphilis has a long and terrifying history, and understanding its origins can help us see why it remains a challenge today. Syphilis is nothing new. Since the 15th century, this STD has haunted humanity, being described as one of the most terrifying diseases in history. For centuries, no one knew exactly where it came from or how it spread. During the Renaissance, it was considered a divine punishment, and many believed that only sinners were affected. The irony? Kings, nobles, and famous artists also suffered from its devastating effects. Before the discovery of penicillin, syphilis drove many to madness, causing paralysis and irreversible brain damage. Today, we know that Treponema pallidum spreads primarily through unprotected sexual contact. But there's another factor that makes this infection even more treacherous: vertical transmission. This means that an infected mother can pass the disease to her baby during pregnancy, putting the child's health and development at serious risk. When this happens, the newborn may suffer from bone deformities, deafness, congenital cataracts, and even neurological issues. And the most alarming part? Many of these babies are born looking perfectly healthy, only to face severe complications later in life. Unlike some STDs that require bodily fluids to spread, syphilis only needs contact with an infectious sore. This means that simple skin-to-skin contact can be enough to contract the disease. In some cases, even a kiss can transmit Treponema pallidum, especially if there are sores in the mouth. That's why thinking syphilis is only transmitted through vaginal or anal sex is a huge mistake. The infection can spread in any form of unprotected intimate contact. Whether due to ignorance or carelessness, syphilis continues to find new ways to spread. But the real question is, once inside the body, how does this disease evolve? Its symptoms change over time, becoming more aggressive. Syphilis doesn't attack all at once. It progresses in stages, each bringing new challenges and complications. In the primary stage, the first sign is usually a hard chancre, a painless sore that appears on the genitals, mouth, or anus. Because it doesn't hurt, many people ignore it and move on. But while the sore disappears on its own, the bacteria remain active in the body, silently advancing to the next phase. It's like a criminal who vanishes from the crime scene but continues plotting new attacks. In the secondary stage, the body starts showing clearer signs that something is wrong. The infection manifests as skin rashes, fever, fatigue, muscle pain, and even hair loss. Symptoms come and go, making many people think it was just a minor illness. But this is only the tip of the iceberg. If left untreated, syphilis enters the latent stage, a period when there are no visible signs of the disease, but the bacteria remain in the body, lying in wait for the right moment to cause even greater damage. Then comes the most dangerous phase, tertiary syphilis. At this point, the infection is no longer limited to the skin or mucous membranes. It attacks the brain, heart, nerves, and even bones. Some victims suffer aneurysms, others lose their vision or develop irreversible neurological problems. In extreme cases, syphilis can be fatal. And the worst part? It can take years for this stage to appear, making diagnosis even more difficult. What seemed like a minor inconvenience at first can turn into an irreversible nightmare. The situation becomes even more alarming when we talk about the impact on pregnancy. If the mother is infected, the baby can be born with severe complications, including bone deformities, blindness, and deafness. In some cases, congenital syphilis can even result in the newborn's death. The problem is that many pregnant women don't undergo routine tests, allowing the infection to go unnoticed. In this scenario, the only real solution is early diagnosis. But how can someone know if they're infected? If there's one thing that makes syphilis so dangerous, it's the fact that many people have no idea they're infected. But the good news is that diagnosis is simple and accessible. The VDRL test is one of the main methods used to detect the presence of Treponema pallidum in the body. In addition, other more specific tests, such as FTAABS, can confirm the infection with greater accuracy. Ideally, anyone who is sexually active should take these tests regularly, even if they have no symptoms. After all, waiting for signs to appear can be a fatal mistake. Fortunately, treatment is straightforward and highly effective. Penicillin remains the best weapon against syphilis, eliminating the bacteria and stopping its progression. But here's the catch: the sooner the treatment begins, the less damage the infection can cause. If the disease has already progressed to more advanced stages, some complications may be irreversible. That's why early diagnosis is essential. Unfortunately, many people only discover the infection after suffering serious health issues, making treatment much more challenging. But if syphilis is curable, why are cases still on the rise? The answer lies in the lack of prevention. The decline in condom use has been one of the biggest factors driving the resurgence of the disease. Many people think condoms are only important for preventing HIV, forgetting that they also protect against many other STDs. On top of that, fear and stigma around the subject stop people from discussing it openly or seeking medical help, allowing the infection to spread silently. The only real way to stop syphilis is by combining diagnosis, treatment, and prevention. Regular testing, consistent condom use, and access to information are key to avoiding this treacherous disease. And if you're enjoying this content and want to learn more about health and wellness, make sure to subscribe to the channel, hit the like button, and leave a comment with your thoughts so far. In the next topic, we'll discuss why syphilis cases are skyrocketing again and why this problem can't be ignored any longer. For a long time, syphilis seemed to be under control, but the numbers show that this belief was an illusion. In recent years, cases of the disease have skyrocketed, especially among young people and pregnant women. But what explains this resurgence? One of the main reasons is the false sense of security. With advances in HIV treatment and the popularity of medications like PrEP, many people have become less concerned about using condoms, creating an opening for the rise of other STDs. The result? A silent epidemic that spreads further every day. Additionally, access to information doesn't always mean people make better choices. The stigma surrounding sexually transmitted diseases remains strong, and many avoid talking about the issue out of shame or fear of judgment. This leads to a lack of routine testing and, consequently, more transmissions. Syphilis, which was once a nightmare in past centuries, is back in full force. And believe me, ignoring this reality won't make it go away. Another concerning factor is the impact of misinformation. Some people believe syphilis is an old or rare disease when, in reality, the numbers are only increasing. Others assume that symptoms are always visible, which is far from the truth. The latent stage can last for years without showing any signs, while the infection continues to spread silently. Without proper diagnosis and treatment, this neglect can be costly, not just for those infected but for everyone around them. The fact is, syphilis is not a problem of the past and must be taken seriously. The only way to stop this epidemic is through education, prevention, and routine testing. Now, tell me, when was the last time you got tested for syphilis? If your answer is, I don't remember, or never, maybe it's time to change that. Your body and your health will thank you. Syphilis doesn't just affect individuals. It is a public health issue that burdens the medical system, impacts families, and can have significant economic consequences. The rising number of cases means an increased demand for treatment, more medical complications, and a growing number of babies born with congenital syphilis, leading to long-term effects on their quality of life. The cost of neglecting this disease goes beyond individual health. It affects society as a whole. The only way to reverse this trend is through effective action. Accessible sex education, mass testing campaigns, and promoting condom use are measures that can save lives. Additionally, breaking the stigma around STDs is essential so more people seek testing and treatment without fear or shame. Syphilis is a preventable and treatable infection, but as long as it is ignored, it will continue to be an invisible threat that grows every day. Now that you know how syphilis silently spreads, the question is, what will you do with this information? Will you ignore it and take the risk, or take control of your own health? The truth is, no one is immune, and the only way to protect yourself is through knowledge, prevention, and regular testing. If you have an active sex life, you need to take this seriously. Your health shouldn't depend on luck. And if you found this content helpful, just imagine what else you could learn to improve your life. For example, did you know there's a proven secret to melting belly fat in record time? If you want to find out how, check out the video Proven: The Secret to Melting Belly Fat in Record Time, and continue your learning journey. But before that, make sure to subscribe to the channel, turn on notifications, and drop a comment telling me what else you'd like to learn. Your health starts with information.